Hi, I'm Dr. Ali with the Performance Place.
And I'm Dr. Sebastian Gonzalez.
And today we're going to be going over Chondromalacia Patella with you. What is Chondromalacia Patella?
I'm so glad you asked. Chondromalacia patella is actually, it's an irritation to the cartilage surrounding the patella or kneecap. It can extend all the way out into the femoral condyles, which is basically part of the femur, the bone that's behind it. Well, we'll show you some anatomy a little bit later just to kind of get you a better idea of what we're talking about. But mainly it's a breakdown of that cartilage. It can happen to tons of people. Do you know who it can happen to and why?
Actually, did you know that 30% of athletes will experience this? And it's actually the most common injury found in sports medicine offices.
Didn't know that.
Cool. So let's go over the anatomy of the knee and find the patella. You're going to start here with the knee slightly flexed or bent, and the bone that's popping out right there is the patella. Bingo. So people who have chondromalacia patella, which is also known as patellofemoral pain syndrome, are going to experience pain right on the surrounding edges over here or just right below the patella. Muscles associated with patellofemoral pain syndrome or chondromalacia patella are going to be your quads, your hamstrings, and your hip abductors. Other associated symptoms with the knee area could be IT band syndrome, which will be more on the lateral aspect of the knee. You'll have like a pinpoint pain right on the outside. You could also have patellar tendonitis, which will be found right down here on the patellar tendon. You could also have PES anserine tendonitis, which will be found on the medial aspect of the knee, and you'll have pain going down and going up that way.
Now that we talked about what chondromalacia really is, we can go over some treatment options and some things we've seen here in the office and what have worked for other people. Dr. Lee, what have you seen?
So in my experience, treating with chondromalacia patella, a lot of people want to first go and rest or apply ice to it. Of course that's going to help, but you also need to address the surrounding tissue and the cartilage behind the kneecap that's actually causing the pain. Techniques such as active release technique, Graston, dry needling can all help with addressing the scar tissue that's been surrounding due to the irritation and inflammation of the joint. Other things that can help you with your performance can be bracing or taping the knee, and you also want to stretch and strengthen the muscles surrounding the area. Typically the hip muscles and the knee muscles with the patella tracking is what's actually affecting the knee.
Actually too, there's probably a lot of things out there controversial about ice I've actually seen lately. I won't dive into it, but you should really see if ice is something that you want to be doing. But actually, surprisingly too, they've noticed that even treatment only by itself to the area, it helps. But at the same time, if you're not combining it with some type of exercise or strength and conditioning, you're really doing yourself a huge disservice, since you can get better with leaps and bounds with something like that.
Well, I think that's about it. Do you have anything else you want to
add? No, I think we're good. If you guys have any more questions about anything, feel free to contact us on the website, or you can always check out our other videos on there. That's p2sportscare.com. Thanks for watching.
Bye.
Don't forget to check out our ebook at the website below.